right, we make welcome right here on the show Dr. David Klein of the Stages of Life Institute there in Longwood, right off of I-4, very easy to get to. And later on in this segment, we'll have Robin chime in and give us direction and contact information. But today and the rest of the week, we're going to be talking about some things that probably never crossed your mind, but they have to do with your health. All right, doctor, you wanted to talk today about diabetes and dementia. What do those two have in common besides D and D?
Well, oddly enough, they have everything in common and common cause, as it should turn out.
Really?
Well, yeah, what this is really all about, okay, is those of you that either have diabetes or know somebody that has diabetes, which probably includes everybody listening right now, there are issues that involve the blood sugar that you are quite familiar with. You know, well, if my blood sugar's this, my blood sugar's that, my blood sugar's under good control. Yet it's actually the insulin levels that cause the damage. Okay, when your insulin level is too high in order to control your blood sugar may be under perfect control, but the insulin is pro-inflammatory. And what this does, and the reason why this is associated with many chronic illnesses, to include Alzheimer's dementia, is that it causes a vasculitis. So what happens is this: the body starts to become resistant to the effects of insulin. You start to jack up your insulin levels in order to control the blood sugar. The insulin does two bad things to you. Okay, it may control your blood sugar, but it lays fat down on your abdomen. But it also causes inflammation inside certain smaller arterioles and certain organs, to include your eyes and, oddly enough, your brain. So insulin goes up, your health goes down. So instead of focusing on the blood sugar, you should be focusing on the insulin to glucose ratio. Now, you're not necessarily going to hear about this at your family doctors, although eventually, maybe in 10 or 20 years, you might. But here's the downside to that. You just may not be around to hear it. Mm-hmm. And in that, if you don't do something about it now, you may not be in a condition to do anything about it. So here's the issue. Insulin is not such a great thing to have an abundance of. It's a good thing to have an abundance of money. It's a great thing to have an abundance of sunshine. It's not a good thing to have an abundance of insulin. So insulin resistance leads to Alzheimer's dementia. So how would you really do anything about this? Okay, well, the first thing that you need to do is to know your numbers. It's great to know your cholesterol. It's marvelous to know your triglycerides. Mm-hmm. It's worse to know your age, but you really have to know your insulin. So there are many things that a doctor can do to help you lower your insulin, to include the use of a freebie at Publix called metformin. That will lower your insulin level, will also lower your blood sugar level, and reduce your risk of cancer because, oddly enough, high levels of insulin are also associated with high incidence of cancer. But we're not going to talk about that today. We're going to talk about your brain. So insulin causes the deposition of amyloid, which is thought to lead to Alzheimer's. Okay, what else does it do? It leads very, very directly to something called microvascular dementia. Now, that's kind of an important mouthful, let's say. Okay, microvascular dementia means that the small arterioles leading to your brain become inflamed, they become clogged, they become occluded, and you start to lose little pieces of that valuable organ known as a brain. Now, it's sometimes obvious. Somebody will come in with a stroke. Sometimes it's not so obvious. They come in with progressive dementia. We find they have something called lacunar infarcts. These are these little Swiss cheese holes in your brain that come from these small strokes that you don't even know are occurring. TIAs are transient ischemic attacks. This is a precursor to stroke. It may actually represent small subclinical strokes. Okay, but any way that you cut it, as these small arterioles start to become inflamed, bad things happen. Now, you can see it visibly on physical examination through something called a fundoscope. When they look in your eyes, you can see things that start to degenerate in diabetics. You can see it degenerate in non-diabetics with high insulins, and you will develop something called macular degeneration. So the treatment of macular degeneration, vascular dementia, and Alzheimer's, as well as insulin resistance, are all related. You can't walk away from this without thinking that, gee, what am I doing wrong to lead up to this? So one big issue is being big, okay? Weight gain leads to insulin resistance, but really more so, insulin resistance leads to the weight gain. So the insulin resistance started years ago. It could have started when you were a teenager. It could have started somewhat later than that. But as you started to gain weight, insulin levels started to go up and your risk of dementia increase. So we need to focus on a couple things here. We need to focus on awareness. Your awareness of your insulin level as well as your blood sugar level. You know, you can know your A1C. Oh, that's great. What's the A1C tell you? It tells you that you had one bad day in the past 90 days with regards to your blood sugar. Congratulations. You probably already knew that. One nasty little donut and it's all over Irene as far as your A1C is concerned. But your insulin is dynamic. It will change moment to moment, hour to hour, day to day, month to month. Okay, because your diet changes, but also more appropriately, the things that control insulin receptors will change very, very rapidly, and it's something that should be monitored fairly consistently. You need to check your CRP, stands for cardioreactive protein. What this does is it tells you what the inflammatory markers are looking like inside the arterioles. This is a much better marker with regards to how well you've done over the past 90 days, and it just is what it is. It's starting to catch on a little bit, but as these things turn out, the weight, the diabetes, the blood sugar are all a result of insulin resistance. So what can you do? What should you do? What are you able to do to bring this thing under control? And giving up is always an option. Okay, it's not my favorite option, but of course there are a lot of people that go, oh, well, I don't have the time, I don't have the inclination, I think that we're just lazy to do anything about it. Okay, now, as you gain weight, it gets harder and harder to lose weight. Everybody knows this. Everybody experiences this. So the trick is not to allow it to keep going, let's say. If you can arrest the weight gain, it's a whole lot easier to start reducing than it is to do much else. I decided I was going to lose weight before Thanksgiving. Okay, well, that's just not usually done. I'm going to wait until after the new year to start my diet.
Yeah.
Not me. So I went ahead and lost 11 pounds since Thanksgiving just to prove a point to myself, okay, that I did not have to swim upstream along with everybody else starting in the 1st of January. So what do? Insulin resistance will result from one of several things, but the most important one is chromium and vanadium deficiency. So these two metal ions are present in our water supply, or they should be, or they might be, or they could be, but here they are not. Okay, so what happens is vanadium and chromium are necessary for the insulin receptor to be held together. So when you don't have these two metal cations, which by themselves really are rather innocuous, you take too much, they're poisons, too little, they're poisons.
Ooh.
You have to know what you're doing, okay? Insulin levels will diminish. Metformin will reduce insulin levels, but it doesn't keep you from the need to replace these two metals. What else will do it? Inositol, oddly enough, is an interesting little sugar that will lower your sugar. Go figure that one out, okay? Because it modulates the way the insulin receptor operates. Bromocriptine is one of my go-to medications for those individuals that can't respond to the aforementioned medications. But any way you do it, you have got to focus on your insulin level. You've got to focus on this because it is one preventable cause of dementia. It is one very, very important aspect in your life, and it's one that I'm hoping to hammer home to at least those people that are listening today.
Okay, and again, folks, you've got to get these things taken by going to the doctor and asking for these readings. Robin, how do we make a connection with the stages of life?
Give the office a call at 407-679-3337. You can find us on the web at stagesoflife.net. We are also on Facebook at Stages of Life Medical Institute. Office hours are Monday through Thursday, 8 to 5. Health store is open during office hours, and we are located in Longwood at 1917 Booth Circle. That's right off of I-4 and 434.
And tomorrow, we're going to be talking about menopause and weight gain. Yeah, do the two go together? Well, we'll talk to the good doctor and find out as we have Dr. David Klein right here every day.